It often begins with one person, one voice calling others to action. A call that brings people together, united in a common cause. And a cause can start a movement of incredible power, a movement that can make history and prove that people can make a difference. Today, those of us in behavioral health care can also make a difference. Our objectives are different, and so maybe are our tactics. We no longer need a revolution to impact the government decision-making process. What we need are people taking action, making their voices heard. We need the power of citizen action, the power of grassroots. While the behavioral healthcare industry has had many successes, we continue to face monumental challenges. Federal proposals to limit the scope of Medicaid coverage for both rehabilitative and case management services threaten the foundation of our community-based treatment system. Our nation's growing number of returning veterans, particularly National Guard members and reservists, are finding it difficult to access the federally financed mental health and addictions treatment services they need. And far too many people with serious mental illness are detained in our nation's jails and prisons rather than receiving the community-based care that they need. While there is a growing public awareness and acceptance of addiction as a treatable disease, higher cost sharing for addiction treatment continues to discourage many people from seeking treatment. These and other challenges affect our jobs, our future, and most importantly, our ability to provide high-quality behavioral health care services to those we serve. Each day, we have an extraordinary impact on millions of Americans. Our challenges don't just come from our efforts to help those who are least able to get help, but also from the legislative arena, both at the state and federal level. Community behavioral health care organizations must make their voices heard above the rhetoric.
No one else will be our voice except for us. We are it. No one else will speak on our behalf. And when I say us, I mean us as the total of the community. The individuals who work as well as the individuals who are affected and all of their families. That is the voice for mental health and for addiction services in the United States. There is nothing more important than we can do than create firm, sound, productive relationships with our elected officials. We have to be their resource on these issues. We have to be the ones that bring these issues to the forefront, and we have to be the ones that get them to recognize that these are issues to be reckoned with and that we're to be reckoned with.
National lawmakers say that grassroots efforts are crucial.
It's incredibly important to hear from people who are experts in mental health. People need to be reminded that mental health is a very important issue, and it ought to be at parity with the rest of the health care of America. By visiting the Capitol in the way that you did today, it makes an enormous difference in terms of the knowledge of the members of the United States Senate with respect to mental health.
The policymaking process has become more complex thanks to a rising tide of legislation at both the state and federal levels. And as that legislation piles up, legislators more than ever need their constituents to tell them what issues are important.
The attention span with a lobbyist is 1 minute because that's all they see all day long, and they're going, okay, what you want, what's the vote, what's the issue? All right, got it, I'm either with you or I'm against you. Then you bring in a professional that can tell them something real, and they get that, and that's maybe a 5-minute attention span. But then you bring in a personal story, somebody who's had direct personal experience, either the client or their family. They can tell the story of what mental illness has done to their family, and then even more importantly, the value of this community mental health care and what it's done to turn things around. That sticks with them, and it sticks with them forever, and it's much more powerful because it grabs them emotionally. And I have found that there's no time limit on those types of stories. They will wait and make the people next to see them wait until you've told the whole story because they really want to get it, and that makes a huge difference for them.
They'll listen to that, they'll be receptive to it, if we can also show them that we represent an interest in their district that they really ought to be concerned about, that we really do represent a sizable piece of their constituency.
Grassroots works because legislators listen when their constituents speak up, because individuals can make a difference. This is why behavioral healthcare managers, staff, and consumers are joining up to make their voices heard on public policy issues impacting the community behavioral healthcare system, both in state capitals and in Washington, D.C. There are many ways to contact your legislators, whether it's through in-person visits with others as part of the annual Hill Day, or through phone calls, emails, and regular mail. Make sure your message is personalized by writing your own letters or emails.
But the best of all is a personal visit. It has a tremendous impact on the congressman or on the senator. So as you go into this phase of your visit down here, understand that you're sort of carrying the ball for those that can't be here. I mean the ones that you represent in the National Council, not your fellow members back home, but I'm talking about the disabled and the mentally ill.
Lawmakers and our members agree you can make a powerful impact. Your organization's grassroots efforts are your opportunity to speak up and be heard loud and clear. This is your chance to participate.
Today was absolutely great. We did a National Hill Day visit with the National Council on Mental Health. It exceeded my expectations. Of course, I'm from Oregon, and my Oregon group are really tied into the mental health issues. It was wonderful.
Be prepared, but don't be intimidated by the circumstances, because the people are just people. If you understand the issues, you don't have to understand a lot of detail, but if you understand the issues generally, they're very receptive. They want to hear from their constituents. They want to hear the real-life stories.
Make sure you know your member of Congress, and make sure your member of Congress knows you. But you want them to know you as someone, as a reliable and valid source of factual information. They want to know, you want them to know you as someone who's a point person they can turn towards when they're trying to find reliable information. Because believe me, truth is hard to come by in this town. Facts are hard to come by in this town. If you can be that person for a member of Congress, you have achieved something remarkable.
So what are we asking our members to do? What we're asking our members to do is to be a strong voice here on Capitol Hill and with the administration. And what that means is get to know your federal elected officials. Come here to Washington, go to their office, talk to them about the issue that's important to you, and then when they're back home, visit them there too. Then have them visit you at your center. And stay in touch, keep in touch, and it will make a difference. We're up against a lot of very strong lobbying interests, but we have right on our side. The work that our members do every day is very important work. And if we can get their stories across, if they can come in and tell about the people they serve, that will go a very long way.
You may be asking yourself, how do we get started? The first stop on your journey toward becoming a more effective political advocate is the National Council. The National Council provides you with all the tools you need to become as effective an advocate as possible on important public policy issues. Please join the National Council in a partnership of action that will shape the future of the community behavioral healthcare system in America. In the words of John F. Kennedy, our task now is not to fix the blame for the past, but to fix the course for the future. Your action can change the future with the power of grassroots. The next step is yours.